I'm here with my dear friend and colleague, John Kanellopoulos. John, you gave a really, really nice talk on your 1 month data, 1 month follow-up on femtosecond laser-assisted LASIK. Can I get you to talk about that?
Yes, absolutely. Thank you, Josh, for having me. Really pleasure. We reported on a two-center study, one in Athens, Greece, our center, and one in the U.S., Vance Thompson's center, on prospectively looking at femtosecond laser LASIK cases with the Wavelight FS200 and EX500 platform on treating myopia from -1 to -10. Basically, this study reiterates that femtosecond LASIK is a very effective procedure. It's a very accurate procedure, very safe procedure, and at 1 month, the numbers of patient satisfaction are the best we've seen yet.
Because the data that you were looking at was patient-reported satisfaction data. Is that correct?
Exactly, and we looked at it in many different ways. We try and look at the early recovery stage, meaning how fast the patients were able to go back to their normal daily activities, driving, using computer, reading, and then looked at the amount of discomfort the patients may have had. We of course focused more on the female factor of maybe having more dry eye, as we have in our experience in the past. And we found that the overwhelming majority, 96% of the patients, were able to go fully back to their daily activities from day one without any significant deviation up to month 1. Actually, the hardest thing for most patients was the fact that they couldn't shower and wash normally just the first week.
Huh. So, having learned this, how big a portion of your LASIK practice outside of this study is femtosecond created flaps?
Well, we've moved on to femtosecond almost a decade now, and within the first year of that, we went 100% femtosecond laser. And in our practice, we don't have a staged procedure as far as the fee is concerned between a keratome and a femto, and we use femtosecond laser in 100% of the cases. Seeing the technology evolving and seeing customized options with this specific platform, meaning the ability to design each flap according to the ablation plan, and you can do this through the software. You can do oblique flaps, you can limit the flap size according to the ablation you're planning to do, thus reducing the potential for dry eye in patients that have the potential to be more susceptible to it. Gives the surgeon the ability to not have one procedure for everybody, but to customize it. And I think this is one of the pivotal things that has helped us to reach such very high satisfaction levels. And that's where the truth is. We as surgeons usually see just some plain rigid number parameters, visual acuity, refraction, but the fact of how impactful our procedure is and how easy for the patients to transition from this procedure, I think is the best thing about LASIK today, about femtosecond LASIK today.
John, this is really, really great stuff. It was a wonderful talk. I'm delighted that you've shared this with us, and of course I'm so grateful with the time that you've chosen to spend with us today.
Oh, thank you very much, Josh. My pleasure.